Welcome to the office.
Hola.
Hola.
How are you?
Good, and you?
Welcome.
Thank you.
Carla, how can I help you?
I'm having issues with my leg, my lower back, and some sciatica issues that is affecting my foot.
Right side, left side, both sides.
It started with this one, and now it's kind of starting with the other one.
What's number one? Number one is the back.
My back.
Low back.
My lower back.
Started when?
I've been having issues for so many years already with it.
Over 10 years?
Yeah, pretty
15
much.
years?
Yeah.
Okay. Was there a trauma you remember?
Well, I've been in car accidents.
Okay.
And then actually today when I was getting the x-rays done, I remember that I fell on my butt
When?
back in like 90 some before 2000.
Okay.
And I was trying to rollerblade, and I
Okay.
just boom, fell on my ass.
Okay, so over 20 years ago.
So it's been, yeah.
That makes
it's
a
been
little
quite
more
some
sense.
time.
Okay.
Yeah, but I didn't really think about it, that it injured anything, but it just.
You were hurting for a little bit. You did any treatment or just let it
No,
be?
because it didn't hurt before.
Okay.
I started having issues after I had a car accident, and then it has been progressing.
So number one is the back, number two is the neck. Sciatica is a symptom associated with your
my
back.
My foot started hurting right here.
Okay.
To the point.
She's pointing to the cuboid bone, by the way.
Right here,
Yes, yep,
in this
that's
area
the
right here.
cuboid bone.
To the point where in the morning I would get up and I'll try to get and I couldn't really step on it.
You step in with a lot of pain.
With a lot of pain, and then it kind of when I started to stop doing like a certain movement, I noticed that it wouldn't hurt, so that's why I slowed down the clinic even more.
Got it, okay.
But then it started happening on the other one.
So when it shifts sides and it goes from one side to the other, we're thinking compensation is fine, right?
Yes.
Okay.
Yes.
All right. Anything
So-
else for me?
Yeah, my tailbone. That's when I'm like, because sometimes I notice that when it starts like bothering me or hurting.
Sitting on it, you mean?
Yeah. Well, when I sit up for long periods of time,
Security.
yeah.
Okay.
So and then kind of like affects the
What?
when you go
The
to the
knees,
range.
going to the bathroom, but you are
Yeah.
going to the bathroom?
No, yeah, I'm going
No
to.
issue going though? Maybe it's painful to go?
No. How can I say this? I notice like if I sneeze,
You feel back pain?
no. Well, yeah, I do feel back pain, but
With
I'm
the
saying
sneeze?
with the sneeze, like
Ah!
when it hurts.
So that's a little serious because
Yeah.
that's incontinence, right? There's a little bit of urinary incontinence with sneezing.
Yeah.
So that's also good. When it's in pain.
Yeah.
Yes.
When I'm not having no issues with it, I'm okay.
All right.
So it just that I cannot really do
So
what I want to.
what am I gonna do for you?
Fix me?
Oh, that means you're broken?
Yes,
You're
I'm
not-
very broken.
You're not broken, okay? You just off balance.
Okay.
And no one, I think no one gave you an answer. Now, you did bring me, because you have very interesting
Yes.
x-ray findings. We need to go over these x-rays.
Yes.
And because there are a lot of people who have asked a question relating to your case. Meaning, with what I see here, I'm remembering a lot of comments people have asked. And that's why I'm happy you're sharing this, because it gives me an opportunity to teach what this low back issue is.
Oh, okay.
Okay? I will make sure I will keep explaining until you do.
Okay.
Okay?
Thank you. Appreciate
And then
it.
we'll get started.
Yeah, because nobody has really explained to me what.
Let's do it. You're coming because the number one issue is this back with sciatica. That's number one. So we want to explain this. And your case is unique. I want to go over it. Let's talk first about the AP film, and let's look. And what we can see is this. Okay, we can see we have a little bit of curvature of the spine here, right?
Yeah.
Body's off balance.
Yeah.
Okay, and I'm going to zoom in now in the pelvis. So let's go over this and let's see, what do we see here? We have a short leg on the right, yes?
Yeah.
We have a sacrum kind of bent to that right side.
Yeah.
We can see through this SI joint here.
Uh-huh.
We can see through this SI joint here. However, there's a little bit of binding at the tops there, okay, in terms of scar tissue.
Uh-huh.
We have a slight bend in our tailbone here, ma'am.
Like that?
Yes, ma'am. Now, here's the interesting part. This is the sacrum, okay? This is very interesting because seeing this circular appearance on the tailbone is because you're looking at the top of the sacrum.
Son of a gun. Is that why I feel like my lower bottom is gonna fall off?
Well, let me get to the side and explain. Okay. So this is you, and you have a pretty significant base posterior sacrum, BP sacrum. Dr. Gonstead, in this methodology, explained, described, and drew the differences. There's 3 differences between an L5 going back. I'm gonna educate a little bit if you don't mind. Okay. L5 can go back, right? So typically the L5 adjustment, L5 goes posterior like this. You set L5 forward. That's not your case. L5 should not be touched on you. Okay. Then the discrepancy is this. So we have L5 can go back, sacrum can go back, or L5 can be what's called a spondy, where it goes anterior to both fore and sacrum. You brought me some reports, and your report says there's anterior displacement. Does it follow my process? It says there's anterior displacement of L5 on sacrum. That's actually incorrect terminology, okay? You have what's called a base posterior sacrum. It's not that 5, because look, 5 lines up with 4 and 3. All that lines up perfect. You have an old pars fracture, yes, and that says on your report. I agree with that. This is a pars fracture that caused the tailbone to go back. And that threw the mechanics of your whole spine off. I have a BP sacrum. I know what this is. It took me a long time. So when I look at the shape of your disc, 25, 30 years, dude. It's an old injury.
Yeah.
Okay. And the disc, I mean, there's hardly any stuff there. So my goal for you would be this. My goal would be to get as much of your BP sacrum done to maintain. Now, they told you there could be a surgery, okay? This disc is very thin. There's work to do, okay? Is this disc gonna fully hydrate? No. Number 1, stop the further degeneration. Number 1. Number 2, can we get more movement and decrease the pain and symptoms? And we'll know within 3, 4, 5 maybe adjustments. That's it. And then we'll make some decisions from there what you want to do. Okay, fair enough? That way, my focus is your sacrum right now. Whatever else I find, I'm going to get to the rest of the x-ray. But it is very clear, sacrum is posterior. If L5 was anterior to both sacrum and fore, that would be called a spondy. That's another type of adjustment or another type of trauma misalignment. Conversely, L5 can go back, and L5 would be posterior to the sacrum and would take all of these with it. So your case is take the sacrum, bring it down. However, there's another catch to this. You got an old nub here, right? That's another old injury. So it did this. A BP sacrum is like this. Is it a direct fall on the tailbone? It could be, but a direct fall on the tailbone is usually a coccyx. But it will affect the sacrum. It's more that it went back this way. It did this movement. So the tailbone, this, went back, so you fell more back and then on the sacrum.
Yeah, because I fell backwards.
That makes more sense. Yes, so that's correct. Okay, can I continue?
Yes.
Okay, so from there, these discs are good. 4, 3, it is tilted. 2, 1. These discs are all good in here. Little wear and tear in there, but they're still decent. In your neck now, okay, we don't have the right curve, right? It should be a forward curve. These are about same thing, about 15-year-old injuries in the neck, 15, 20, whatever. So if we look at the neck, this is your neutral, this is extension, this is flexion. And in flexion, they should all move forward. These all moved. This one didn't move, T1. 2, 3, 4, 5, 6, 7. T1 didn't move. It's still angled right there.
We're supposed to be more stable.
They should all be moving forward. Okay, so when we're looking at the mechanics, when you go back, they all move back. When you move forward, they all move forward. This one didn't move.
It's like this. Instead of going like...
Correct. So it's doing this. It's going in the opposite direction.
Yeah, because sometimes I get a pain here, like when I'm sleeping.
At the base of
that
the
it
neck.
forced my head to go like that.
All right. Now, this is this is a pretty serious issue. I got to explain this, okay? It's no joke. And you have a short leg on the right side, 16 millimeter measured difference. This actually needs to be under 7. Yeah. You had a tailbone injury on the left, P2-L, but it dropped 3 millimeters on the right. So 3 millimeters of the short leg is coming from that, but still that's 13. If I adjust your left hip, I make your leg worse. So your answer is not your pelvis. Your answer is your BP sacrum. Okay?
Okay.
That's where we're going to start. However, I don't know what's going to happen yet with this. I'm not going to tell you I do. And the reason why, a heel lift right now is not indicated for you. Meaning what? Typically, if it's over 7 and we can't fix it with adjustment, we have to put a lift on that side, a heel lift.
Oh, okay.
Okay, but in your case, we can't. It's going to make it worse also.
Oh.
And let me explain, because the curvature, it's not scoliosis, but the lumbar curve, body rotation, is opposite the side of the short leg. And in the chapters, the Gonstead chapters, if this curve is opposite the short leg, you put this up, it's going to make that worse. So that's not the answer either. So you're a fun case. You're going to be a fun case. We got to figure this out. Okay. ¿Entiendes?
Sí.
You understand what I'm explaining though, right? Okay, jokes aside.
Yeah.
So it goes to the left, opposite the short leg, then it wants to come back. The shape of the bones tells me you did a lot of heavy lifting because they're starting to curve. It's okay.
I'm trying to work out.
Now here's the thing. It starts to curve again to the right, then it starts to curve to the left. So all of this is compensation from your lower sacrum and the hip. Yeah. That's it. And then we got a jaw deviation. C2 is wedged on the right. Okay, C2 wedged on the right. Your atlas is wearing out. Yeah, you fought. I mean, you played rough. Okay, so we got some work to do. Your main issue is your foundation, sacrum, BP. Let's get started, man. We're watching her dimples. They should move up and down. Let's see you walk, madam. You're going to walk to the corner of the room and back 2-3 times. So you can see that little Honduran tinkle on the right side and the dropped leg. Is this how you walk? Do you look down or do you look straight? Look straight ahead. So she's got some movement in the hips there. They do move, but there's a lot of this.
And then when I walk, I kind of like go like put my heel first. And when I walk, I kind of like step hard.
Well, you're stepping hard because of the imbalance, okay? That's why. So the imbalance going side to side and front and back. And what I want us to see right now is, you can see this, it goes to that side. So you're dragging to one side, okay? Come over here and let's get started, dude. Starting at the base, first thing we're getting, C7. Yeah, it's just 20 points. So we got C7, T1, 20 points. T6, 10, 11 points. This is your digestion area.
Fat?
It's off a little bit, yeah. Now typically when there's a disc that thin, okay, it's been there a while, and those discs actually the nerve readings or the pressure readings are small, or it could actually go, the nerve can go cold because it's been blocked for so long. And so in those cases, sometimes what happens is you get a very, very small break, or you get a break opposite the real problem. But in her scenario, we actually have to start lower than the base. Okay, so we're getting down low in the sacrum, S2, S3. We're getting the mid-back around T5, 6, and we're getting the base of the neck, C7, T1. Now, let's check the movement in the hips, please. Feet together, feet touching. Open and close your knees with your feet touching. Open and close. Right side only. So when she does the right, the whole left is moving with it, left side only. But same thing is happening when she does the left. Both are stuck. Now, let's go over here. This is L5. Okay? L5. S1. Right there. S2.
Ouch.
Or S3. S4. No. It's S3. Right there. See?
I feel the pressure.
She has a high pain threshold, dude.
Wait, what?
You have high pain tolerance.
Oh, yes, I do.
Right there.
Right there.
Okay, that's the S2. 2, 3, 4, 5, 6. ¿Duele? ¿Número 5 or número 6?
6.
Head down, please. Static palpation. There we go. 1, 2, 3, 4, 5, 6. So all this is swelling, okay?
Oh, it's not fat?
No, dude, it's inflammation.
Oh.
This inflammation. Right there. S2 sacrum or actually it's a BP sacrum. BP sacrum, T6. Let's check the neck. 6, 7, 1. Ahí. 1. T1,
It wasn't supposed to do that. I'm like trying to relax as much as possible because I'm usually very tense and I know that doesn't help. So I'm trying to be...
You ready to receive? Are you ready?
Yes.
Let's get started. So we're going to do BP sacrum on the high-low. We're going to do T1 and T6 all on the high-low.
Okay.
So in her case, this is going to be an interesting case, guys. We have work to do. And as I said, it's not that thin disc, D5 disc, is going to rehydrate in a short period of time. We need to get things moving, stop the further degeneration, and after a few visits we'll make a decision on what she needs to do. If she's required to get any sort of intervention, any surgical intervention, the idea is to prolong it as long as possible because she's young. Okay? 5. Now for the BP, it needs to be actually S1, and it needs to go S to I this way, and it needs to torque to bring it up. My name is Hemi. Hemi. I like to cracky. Crack.
Ay,
Homework.
Sorry.
Perfecto. Uno más, señora. Oh, gotcha. Bueno. Espere. Let's walk. You okay?
Yeah.
That was deep, madam.
Yeah?
That was deep. You okay?
Yeah.
Something
Feel a
happened.
little.
Dizzy?
Yeah.
You need some
I
agua?
I try to relax as much as I
Why
can.
don't you sit? You actually did very well. Why don't you have a seat? Relax for a minute.
Okay.
Your face is changing a little bit.
Yeah, I could
Just
feel it.
give
I
it a
could feel
minute.
it.
Shall I give you some agua?
Oh, yeah.
Respira profundo. Sácalo. Otra vez. Respira. Sácalo. Otra vez. Now it's time to clean your house. This is your house, right?
Yes.
Time to take care of your house. Bueno,
Yes.
let's recheck. Let's see what we got. Clarísimo. Neck is clear. Mid-back is clear. Now she's going to have a lot of things compensating around because of the foundation. Clear. There's going to be some heat stuff. That's going to be the icing. Mira. 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 Diferente?
Yeah. Feel lighter.
All the way
Like
back.
when I go back, yeah.
It's time for your limbo contest.
Oh boy, don't. No. Yes, but no. I wanna.
All clear, man. That's where we're gonna start, okay? So we did T1, T6, BP sacrum.
Okay.
Let's continue. Ears.
Ay,
Aye. There you go. Shoulders on your back, boca arriba.
this way?
Yes, por favor. Let's work on the ankles. Something came out of you.
I farted?
Energy, energy,
Oh!
energy. You got jokes, lady. Raise your left leg. Come on up. Carla!
I'm just very special and unique,
I
doctor.
see that. Sit up for me, please. 5, 4, 3, 2, 1. Stand up, please. Let's walk it off again.
I feel like I'm going faster.
You are. Your walk is different.
I was about to run into the Oh.
My
Yeah.
name is Himi.
Yeah.
Himi.
Because I usually walk like slow.
Rápido.
I want to like.
Walk on your toes, please. High. Should feel better. That means you can wear your heels later.
Yeah.
Not now.
Oh, oh,
Walk on your heels now, please.
oh, my heels. Oh,
Diferente.
yeah, because they were hurting earlier.
Damn, she's strong. Easy, tiger. Easy.
Oh,
Easy. Take it easy. Elbow. Lunate. Scaphoid. Thumb. Squeeze.
ah.
Relax. Next time you get a nose job and a jaw job. Questions for today. Do you understand what I found? Do you understand your problem, what the issue
Yeah.
is? The sacrum, the
The
tailbone,
sacrum,
the
the
foundation.
Yeah,
And we're pushing it forward and up.
okay.
Okay?
Right here, like how it was looking lumpy, is that like get bigger, or that's because of the issue that I have?
That's because of the dishing in the spine. So this here is
Yeah.
not from here. This is coming from here.
Oh, so is that
This, it's not the hump. Come over
Uh-huh.
here. I want you to see this.
Yeah.
So it's not that a lot of women are coming to me saying, oh, I got this hump.
Yeah.
I explained it in a few videos ago. I explained
Yeah.
it a lot. So it's not that this is a hump. It's that this is dishing inward,
So it's
and
coming
it should come out. And it's starting from here, which is also coming from your tailbone. So the idea is we get things balanced. We get you moving right. Then we can talk about some postural exercises for you.
Okay.
Okay?
Okay. Thank you.
Welcome to the office.
Thank you. Appreciate it.